unlock business hacks and lessons in Bruce Billy's 5-minute management tips with business leaders. Join Irfan and the various respected business leaders in different industries.
Hey guys, what's up? It is Irfan Joffrey. I'm excited to have our next guest with us, radiation oncologist, pharmacist, and entrepreneur, CEO and owner of cancer centers, Dr. Aaron Williams. Welcome to the show. I'm excited for you to share some of your knowledge with us.
Thank you. Thank you. I'm so glad you invited me, and it's always a pleasure talking with you.
All right, let's get right to it. I've got a bunch of questions for you. Where did you grow up? How did you develop an interest in medicine? There are very few minority physicians, I would say, African Americans. And of those individuals that have both an MD and a PharmD and an MBA, you are 1% of 1%, I would think. So how did you develop that interest? How did you grow up with? Did you come from a family of physicians? Talk to me a little bit about that.
That's a good question. I didn't necessarily come from a family of physicians. I did have some cousins that were in the medical field, pharmacists, as well as a couple of physicians. But they were, from a distance standpoint, they were not necessarily, I would say, right there to influence me. So let's just say they influenced me, at a distance. But I still didn't get the reckoning to know I could even like medicine or do medicine until I went to the summer program in Tallahassee, specifically at Florida A&M University. They had a summer program, and for 8 weeks you come on campus and you actually take many courses in the actual courses that you would take in their pharmacy program. You also got exposure to other healthcare professions. So we toured a veterinary school, we toured a medical school. We were already at a pharmacy school. So that summer, I got like a good synopsis, if you will, a small synopsis of what healthcare would be. So that really confirmed my initial inkling that, God, healthcare would be nice, and science is also cool too. So that kind of got me started. Then after that, I did end up going to Florida A&M, and I think the thing that catapulted or increased my interest the most was I was able to get involved in biomedical research at the age of 18. At that time, 75% of the student body was involved in biomedical research. So the summer after my first year, that's what I was doing. And I was in a lab looking at compounds and experimenting with compounds that treat cancer. So that's where my interest in cancer began, even though I was not had no idea at that point I wanted to go to medical school. But the fact that I was able to take this abstract idea of treating cancer, and now I have it in my hands, potentially, so to speak, that blew my mind. And, during that year, when you see that you can make certain compounds, like the first time I made aspirin in a lab, I called my mom, Mom, I just made aspirin, So that's where science was cool to me, and science really oh man, I think I like this. I think I'll stick with it.
What would be your advice to young people of color when it comes to evaluating the direction of their careers?
Yeah, I think the biggest thing is a matter of exposure. And that's what got me. I didn't know I wanted to do it till I was exposed to it. And so I would say expose yourself to, now, of course, not the bad stuff, but expose yourself to everything that you can. One person told me when I was thinking about going back to medical school, I was a pharmacist at the time, and the guy told me, it was a physician. I said, again, I was working in a hospital, and I just casually said, I'm thinking about going back to medical school. And he said, if you have the inkling to go, I suggest you explore it and do it. And that's what I would say at this point. If you have an inkling, I would suggest that you explore and do it. Not meaning that you're going to do it, not necessarily meaning that you may end up being a physician. Physical therapy is a great healthcare profession. Pharmacy is a great healthcare profession. Nursing is a great healthcare profession. So all of those, I think, if one gets exposed to, and then also, bottom line is you got to, care for people, care for patients, care for sick patients. And that's one thing, one of my chemistry professors who I asked to write me a letter of recommendation for medical school, he looked at me, his name was Dr. Turner, and he said, now, if you become a doctor, you're going to have to take care of the people that are nice and clean and have a lot of money, as well as the poor guy who happens to be dirty and unkempt off the street. And I said, yes, sir. So it's that caring part that you also have to have besides the interest in science.
Absolutely. That makes a ton of sense. Now, this might sound like a rhetorical question, but how do you incorporate purpose into your work?
Well, I think that's where the caring comes in. Okay, so you got the caring part. Hey, this is another human being that's been diagnosed with something or needs help with some type of health issue. I think that's one of the biggest, purposes. And then it reverts back to me as a person and say, how can I, with whatever I've learned and whatever I've experienced, help this person, with that. And so I think a combination of wanting to help, other people, and the combination of, kind of satisfying what, you or I have defined as my interests. And that's, some people would say that that's a gift. And I'm not saying that's necessarily something that was bestowed on me, but I do like science, I do like medicine. Obviously, pharmacy and medicine is a long haul, so it's got to be some type of interest and love for it. And I can say that probably what has gotten me through school as well as career.
Got it. What are some of the things that you're doing at your cancer center to differentiate yourself and your practice from others?
Well, I think the biggest thing, I guess our first focus is what I kind of just mentioned, which is to make sure we have the latest technology. And that's not cheap, but not either to acquire or to maintain. But the biggest thing is to make sure we have the latest technology, make sure we have all the service agreements and all that aligned to if that technology does require repair or servicing, we're able to do that. But I think what we're moving into now is not only being there in case patients are diagnosed with cancer, but we want to be a service to the community and say, we want to show you how to prevent cancer or to decrease your chances of getting it. Or if you do, we have a more of a successful rate at achieving a positive result. Over the past few decades, the American Cancer Society has shown in its publications that even though almost 2 million patients are diagnosed a year with cancer, and unfortunately, maybe around 700,000 or so die of cancer. Right now, as we speak, there's about 18 million Americans in this country that are still living that have been diagnosed with cancer. Now, that partly has to do with we've come a long way with regard to treatment, as far as radiation therapy, as far as chemotherapy. Now, what's very popular is immunotherapy. And sometimes we use one of those individually or in combination to treat certain cancers, because all cancers are not treated the same. But the biggest factor is early detection. The earlier we can get something, the more we can do about it. My conversation and the consultation is a lot longer when I have a patient who has an early stage of cancer, because I'm now saying, hey, these are your options that I or we are recommending, compared to if something that has already kind of spread into the final stages, then we're more limited as to what we can do. So I say all that to say prevention, early detection is probably the best way to service the population. So in our practice, we're moving toward providing this preventive early detection media in order to get people in, to not be afraid of having a prostate exam, not being afraid of of having a colonoscopy. You just wouldn't believe the number of people I have to try to talk into having a colonoscopy. And, whereas colon cancer is one of the most preventable cancers if you catch it early.
Okay.
And so prostate cancer is as well. Not everybody falls into that category, but it's certainly a goal that can be accomplished. So I would say preventive care is probably one of the things that will help us as a practice become full circle. Not only being able to treat, but also be able to say, hey, look, this is what you need to be doing if you're this certain age, or you're this gender, or if you have a family history. These are some genetic tests that might benefit and help you, avoid, or if you are diagnosed, get treated.
Okay. So the messaging really comes down to a difference between age groups, genders, and genetic history.
Exactly. Yes. Yeah. Exactly.
What keeps you up at night?
That's a good question. Well, all of us are here, at least in this life, temporarily, whether it's 1 year or 100 years, and you always want to make sure that you try to make every day count. Of course, we get lost. All of us get lost in our requirements that we need for our careers, for our family and community and all of that. I guess it's always like a examination or a report card at the end of the day and say, God, did I do this right? What more could I have done? What would I like to do in the future, in the far off future? So, and a lot of times that's difficult to shut down. Sometimes I wish I could just take the brain and just turn it off. But that doesn't happen all the time. But yeah, that's probably it. Just life in general, goals within those segments of career, family, community, and having some type of impact. Just making sure that once you're gone, you're not necessarily forgotten, and you left your community and world better than where you found it.
Absolutely. I don't have anything to add to that, because you said that so eloquently and so perfectly, but I think you and I are of a very similar philosophy. So I think that's partly why we get along so well.
Yeah, I agree. I mean, life is short, but if you focus on why you're here and what you like to do, that makes it more enjoyable. And particularly when other people can benefit from it, that makes it extra enjoyable.
Yeah, and it doesn't feel like work at the end of the day.
Exactly.
Right?
Yeah.
You get to do a lot more in a shorter amount of time. If somebody wants to reach out to you, what's the best way to connect with you?
Well, of course, social media. As you know, I'm on LinkedIn, and then I have a website, draaronwilliams.com.
All right,
And
awesome.
those are our areas, and I'm on Instagram, as you know, as well as Facebook. The title is The Weekly Wellness Show with Dr. Aaron Williams.
Is that what your Instagram is? How do we find you on Instagram?
Oh, Instagram is Dr. Aaron Williams.
Okay. All right. Very cool. Well, gosh, listen, always a pleasure to connect with you, Dr. Williams. Always sound advice, always well-researched advice. And hopefully we'll have you as a guest back on the show talking about your latest book. I know you're working on it.
Yeah, I'm working on that. Again, everything takes time and to do it right. But yeah.
All right. Awesome. All right. Thanks so much. We'll talk to you soon.
Okay. I appreciate it. Thanks for the invitation. And hey, be well.
Thank you for watching. Did you enjoy today's episode? Don't forget to subscribe so you'll be notified with our next one.